All right, welcome to step 5. You've almost made it through the 6 steps. We just concluded step number 4, treatment options, which really focused on non-surgical management of ACL tears. Here we're going to get a little bit more into surgical management of ACL tears, and more specifically the TPLO. If you hang in there with us in video number 6, we'll talk about the scientific evidence for why we believe the TPLO produces the best outcome, the most reliable results, and has kind of withstood the test of time. So let's get into this video. Why the TPLO? Well, here we've got essentially 4 different views of a dog's knee. These are all views taken from a side angle, and if you were with us in the anatomy, you know very well that this is the femur, this is the tibia, this is the kneecap, and the ACL or CCL lives right inside the joint in this location. This is the meniscus, which is the shock absorber of the knee, and the ACL lives right underneath that. So we want to focus now on the TPLO, which stands for tibial plateau leveling osteotomy. Okay, what we're going to do is we're going to use this surgical procedure to level the tibial plateau. We've got a video that really shows why the tibial plateau leads to the instability. So here, this red line is depicting the tibial plateau angle, or TPA. It's a slope. It's a slippery slope. And when the dog takes a step and the joint is compressed, you can imagine that with this slope, in the absence of the ACL, which runs in this direction, the knee is going to move forward. Okay? The knee is going to move forward. So what the TPLO does is it makes a semicircular cut right there. We rotate that bone, and then we place a bone plate across the cut, thereby changing the tibial plateau angle from something like maybe 28 degrees as shown here to 5 degrees as shown here. And this takes away that slope and thus the need for an ACL. So let's review that. Thanks for hanging in there with me. Okay, this is again the lateral view of the knee. When the dog takes a step, the forces are represented by the green arrows. If the ACL is there, it holds the bones together. If the ACL is not there, the 2 bones separate. The tibia moves forward, femur moves backwards. You can see the ligaments separated here, and that motion is the result of this tibial plateau angle. Here are 2 examples of 2 different dogs. One has a very steep tibial plateau angle. The other one has a relatively normal tibial plateau slope. So this is probably getting close to 45 degrees, and this slope is more like the average 25 or 28 degree slope. As part of the surgical planning, we will always measure those slopes. These are some images courtesy of Dr. Desjardins, a great surgeon at Michigan State University. And this is the x-ray that's taken before the TPLO surgery. As you can see, the measurements are going to be depicted as black lines. So we're going to mark the center of the joint above here, which is the knee joint. Then we're going to mark the center of the joint below, which is the ankle or tarsal joint. We're going to connect those 2 dots or marks with a line, and then we're going to draw a line that is parallel to the tibial plateau angle or tibial plateau slope, as we saw in the other videos. Those 2 lines will intersect and give us the tibial plateau angle. So this line through the center of the joint above and below intersects with this line, which is the tibial slope, to give us the tibial plateau angle. That angle is a measurement that we will use to know how much to correct your specific dog's knee to achieve the desired 5-degree post-operative TPLO angle. That 5-degree angle will result in a neutral knee joint and thus no need for an ACL. The joint will be stable when your pet takes a step. Alright, well, we've got a variety of implants that can be used to perform this procedure. This is a great place to talk about the technological advancements in the implants used for the TPLO. Many websites that I have seen online show pictures and quote complication rates associated with this procedure from before the invention of these plates. These are locking TPLO plates here. This one and this one. This is the smallest TPLO plate available that works on about a 10-pound dog. You can see it next to a quarter. This works for a 10-pound dog. This works for dogs 30 pounds up to about 80 pounds. This is for dogs 90 pounds and above. And if you look inside the center of the holes on this plate, you can see that there are some threads. You can kind of use your imagination and visualize that there are threads on the inside of the plate. These are the screws, the bone screws here, and you can see that they have threads. And the screw head itself is also threaded with a locking plate. So the screw now, with new technology, screws into not only the bone, but also the bone plate. This produces a rigid, angle-stable fixation for putting the bones back together after the bone cut. The next picture will show how that works. So here are some images of a model and then an actual procedure that we performed with the TPLO plate going across the bones. You can see the screws here going across the bones and fixing this all in its new location. The locking plates have significantly reduced complication rates associated with this procedure. We will talk about those complication rates in just a second. Okay, so pros and cons of the TPLO. Well, the pros of the TPLO are that we reduce the progression of arthritis. DJD is a fancy term for arthritis. It stands for degenerative joint disease. So we're going to slow the progression of arthritis. We're going to maintain range of motion. So ROM is range of motion compared to other surgical techniques such as the lateral suture. And we're going to get faster and more complete recovery. So these dogs are going to begin using the leg more rapidly, and then they're going to achieve an overall greater outcome. This is the procedure that's done on police dogs with ACL tears, agility dogs with ACL tears, hunting dogs with ACL tears, and then just really your everyday pet that has high performance needs. It certainly produces the best results of any procedure that I've seen, and in video number 6 we're going to talk about the science and how that also supports these statements. Okay, so cons, things that aren't so great about the TPLO. It would have been really easy to leave this part out of the presentation, but we want to provide you with as accurate of information as we can. This procedure is expensive. I guess that's somewhat relative, but for most people, that is the truth. And we certainly understand that and can find ways to work with you on that. But nonetheless, we're using expensive equipment. Bone plates are made out of 316L stainless steel. The screws are highly and precisely manufactured, and so it's just not the cheapest surgery out there. It produces the best results, but costs more than other surgeries. Okay, this procedure is technically challenging. We are board certified surgeons, attended courses, teaching us specifically the ins and outs of this procedure, and then have a lot of experience through our surgical residencies of doing this procedure. To date, we have done over 300 TPLOs in the Austin area, and are very fortunate to say that we have not experienced any major complications associated with this procedure, such as screw failure or bone failure. This image here is showing a tibial crest fracture. Tibial crest fractures are much less common than they were when the procedure was originally performed. You can see that this bone plate is a different shape than the plate we previously talked about. That's very important to pay attention to when you're looking at other websites that talk about complications. If they're using this plate, it's non-locking, and the complication rates are different than that of locking plates. For instance, this fracture may not have broke if this was a locking plate. Now, the cut in the bone here is incorrect. This is way too skinny of a tibial plateau, of a tibial crest. If you go back and look at the video, the slide before, you can see we leave a much thicker tibial crest to prevent this complication. Infection rates are a complication that is difficult to prevent in any aspect of surgery. We do everything possible. We keep the incision small. We use fully gowned, fully sterile equipment. We're wearing surgical gloves. We change our gloves multiple times throughout the procedure. We use prophylactic, which means just before surgery, or preventative antibiotics to help reduce this. The number one cause of infection is licking. So if you play your part, prevent your pet from licking the incision post-operatively, that significantly reduces the risk of infection. I would say our infection rates are likely somewhere in the neighborhood of 5 to 7%. We don't have actual scientific evidence on our procedures to back that number. It's just sort of a feeling we get. There are publications that do talk about infection rates anywhere from, say, 14 down to 7%. So that's a real possibility. We have been successful in majority of the cases to treat the infection with additional antibiotics, and that resolves all the problems. Occasionally, in about 4, I would say, cases out of 300 or so, we've had to remove the bone plate once the bone is healed in its new location. This does not reverse the procedure. Once the bones are healed with a TPLO, the plate is no longer necessary and can be removed through an outpatient procedure at any time. So thanks so much for following me through the long step number 5, and I look forward to seeing you at step number 6.